Hello, my name is Robin Brasini. This is my week 3 blog for Nursing 406. This course has certainly opened my eyes to different aspects of my personality and leadership style. I've been surprised almost every time I've completed any of these questionnaires for this course. In this particular one, I scored a 28 on the interpersonal skill, which ranks me in the very high range, and a 25 in the administrative skill, which is the high range. Surprisingly enough, I was an 18 in the conceptual, so that put me in a moderate range for that. I was not as surprised by the interpersonal score. I feel like one of my strongest qualities is my ability to empathize and communicate, which I believe is one of the most important aspects of leadership and management. I believe based on my results that I would do best in a directing role. This is described on page 55 of our Leadership and Management in Nursing 4th edition by Grohar, Murray, and Langhin in 2011. And it is, quote, a function of the manager who gets work done through others. Directing includes 5 specific concepts: giving directions, supervising, leading, motivating, and communicating. And it goes on to describe that below. So that was the end of the quote there. I believe that this type of leadership will help to increase employee satisfaction and retention. Both of those will help reduce the cost to the unit and will ensure that the unit has the most experienced and confident nursing staff possible. I would say that would be one big thing as far as resources for units. Is I know that it costs an excessive amount of money to retrain new staff. So if we can increase staff satisfaction and retention, that in and of itself will help with budgeting issues. I found an article through, the NCBI, which is the Clinical Interdisciplinary Collaboration Model and Frameworks. So this article that I found discussed the use of the interdisciplinary collaboration processes. Overall, the results were very positive and showed there was an improvement in patient care, higher staff satisfaction for both nurses and doctors, reduced errors, which increased patient safety, and it helped to control costs. The benefit behind this particular model is that not only does it improve patient safety and outcomes, but it also benefits the staff. Often, at least in my opinion, it can seem like a model of care only focuses on one side of the situation, such as the staff, or the other side, such as the patients. I would say that unofficially, the facility that I work in uses this type of model fairly well. We have very open communication between the physicians, physical and occupational therapists, and the pharmacist, and this usually results in a very simple process to be an advocate for your patient and results in getting responses very quickly to any kind of situation that comes up during the day. Basically, the gist of the whole thing is collaboration means that everyone involved is working towards a common goal, which in nursing basically means patient safety and patient outcomes. I have yet to be in an official managerial role myself, but I've had some experience in lower level leadership, such as resource and charge nurse. I believe that one of the most important levels that needs to be focused on is the staff nurse level. This kind of goes back to my directing concept there, that a manager needs to be aware of what is actually occurring on the unit and then use that information to request staff levels and budget to provide appropriate patient care. Often as a staff nurse, I personally noticed that the ideal ratios for staff does not always accurately reflect what is going on the unit. So therefore, I would lean more towards the descriptive methodology for staffing. Also, based on the results of my leadership questionnaire and the practice model that I chose, I think that I would prefer a vertical differentiation due to the establishment of a hierarchy. I also think that using a contingency structure would be useful because it allows the system to adapt even in a volatile situation. And as we all are very intimately aware, nursing changes each and every day, sometimes by the hour. So I think that these concepts would meld fairly well. just as a end comment, I have found this course to be very challenging because I'm having to decide on what type of manager I would like to be without any actual experience to back it up. I feel like I'm still discovering who I am as a nurse, let alone a leader or manager. My goal is to be the type of manager that I want to work under, someone who finds the fine balance between the demands of the unit and their bosses and the staff that work below them. I look forward to seeing the comments on this blog post, and I wish you all the best of luck as we continue on this course.